Good evening, everyone. I'd like to call to order the CMH Program and Budget Meeting for September 10th, 2025. Please stand for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next item will be the reading of the mission statement from Megan.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Before we get moving, I want to welcome Jackie to her first meeting. Welcome to the board. We're excited to have you. And yeah, it's odd for me to chair this one, but bear with me. Here we go. I usually get to do the ones where we lump everything together and just approve, and we're out of here in 10 minutes. We're going to be here a little bit longer than that, I think. With that, we'll move on to item 3, adoption of the agenda. I'll take a motion to adopt.
Support.
Motion from Donna, support from Lori. Any comments or changes to the agenda? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anybody from the public? Everybody's going to speak later. All right, we'll close the first one with the public. There's one more before the end of the meeting. We'll move on to item 5, request to approve. Item A, request to approve the budget for fiscal year 25-26 facilities expenditures not to exceed $53,000. I'll take a motion to move this to full board. Motion from Lori, support from Sharita. Sure. TJ, come on up. After that long, awkward pause, and everybody jumping in.
Good evening, everyone. I apologize. This really shouldn't have been listed as a budget for facilities. This was more just something that we put together. I talked to Tracy. There's a number of things that are coming up for facilities that are going to pass the $5,000 threshold for ask. And rather than bring each one of those items to you, we decided to combine these and do a not to exceed in each of these items so as not to burden not only you, but some people internally as well. Tracy always has to give me the permission, so just so you know. It's laid out pretty specifically here. If there's any questions about any of these, 2 of the items are fairly urgent. We have to get these taken care of. The other items are listed as annual items that we go through a normal contract. Everything we do is now contractual as far as an annual basis. Thank you, Ken. And we're just asking for that money not to exceed. This allows me to shop it around a little bit as well, try and get better prices than the year before, but not have to bring it back to you over and over again for each individual one. So that's really what's spelled out here, and that's the ask.
Thank you, TJ. Are there any questions? For full board, we'll remove the words budget, and we'll just call them expenditures. All right, seeing no questions, all in favor say aye. Aye. All opposed? Motion passes.
Thank you.
Thank you, TJ. Next, we'll move on to item B, request to approve TMG Microsoft Dynamics 365 user licenses, 3-year renewal agreement effective 10/1/25 in the amount of $34,071.78. I will take a motion to move this to full board. Motion from Megan, support from Selena. Tony, go ahead.
Yes, good evening. Just to clarify if it wasn't clear in this statement, number one, this is our general ledger system. It's where we do all of our accounting, pay all of our providers. These are the license renewals. So we have an option right now. Microsoft is going to be increasing the licenses, and that would add about $5,400 over 3 years. However, we have a window of opportunity right now that if we sign a 3-year agreement, as we anticipate continuing to use our general ledger system, then we get to lock in the current rate for 3 years. So essentially, we could save money if we approve this and lock into the 3-year agreement.
Thank you, Tony. Any questions? Okay. All in favor, say aye. Aye. All opposed? Motion passes. Thank you, Tony.
Welcome.
Next, we'll move on to item C, now the budget. Request to approve the fiscal year 2026 original budget. I'll take a motion to move that to full board. Motion from Julia, Sharita. There's only two of you over. It's 50-50 shot, and I still get it wrong. Sharita and Lori, right? Okay. Take it away, guys.
Good evening, everybody. This is our fiscal 26 budget. We're going to cover some of the narrative items first, and then kind of illustrate it with the numbers in the back. Up front, just want to say that, we try to prepare a conservative budget, kind of what we would consider the worst case scenario right now, which I think is reflected here. It's based on the assumptions that we have right now. Cover revenue in a minute, but for example, we do not have final rates from the state. We've had some tentative meetings with them. We have draft rates that are reflected here. But I just wanted to remind the group of that as we go through this document. So I'm going to go to the first page with the bulleted narrative. Generally, I'm going to cover revenue, and Tony's going to be working through expense. So the first thing we have here, and it kind of ties back into the comments that I just had, we're going to see a significant decrease in revenue. I would say that there's two major components driving that. One is the CCBHC direct pay. I think we've talked about that a little bit. We're starting on 10/1. The state of Michigan is going to start paying the CCBHCs directly. That includes us plus the other 3 CCBHCs in our county. But as a result, to do that, they've pulled revenue out of our budget to facilitate that. The base cap portion, if you remember, there's 2 pieces of it. The supplemental piece, which is, I'll say, cost settled separately, and the base cap piece, which is part of our capitated revenue on an ongoing basis, right? So they've pulled that out, and they're going to direct pay the CCBHCs themselves, as I said. So the other piece is, after you consider those items, we're still looking at, based on the draft rate materials, $21 million decrease generally. I have an email into the state, questioning some of the assumptions that we saw in the rate materials. One of the things that I think is highlighted there, that we push dollars back, or we increase rates in 2025. Their rate materials are based on 2024, so we have roughly $7 million of expense that's not calculated as part of that. So we did send some of that information to the state and have not heard back as of yet. We haven't had a final rate meeting. I haven't seen anything final. So what we have here is based on those draft rates. If we have anything over the next couple weeks, we may have to revise this, hopefully to the better. But that's the situation there. So everything else is, from a revenue perspective, I think generally pretty static. Our general fund dollars have not changed. I don't envision a scenario where they're going to change. We get the same amount from the county. Grants up and down a little bit. We've seen a reduction in grant funding in some cases as it relates to SUD and some of the programs that the feds have cut at that level. So those are generally some of our revenue assumptions. I'm going to cover the ISF piece in a subsequent page. So, Tony, if you want to cover some of the expense.
We're staying on the same page, moving to the section 2 on expenses. So the first thing is, anticipating some CCBHC work expansion and some of the support for the direct pay. There's any position that is budgeted for that, we budgeted at the full amount. So some of those are still to be defined, but we did put money in the budget to account for anything that we need to support, or positions we anticipate to support the growth in the CCBHC activity. The next point that I want to spend a moment on is looking at our network. We've talked about this before, and looking at how much we've lapsed to the state, optimizing our ability to push dollars into the network to help stabilize our providers. There are a couple areas that we really were focusing on in our budget this year. Number 1 is inpatient. Number 2 is specialized residential. So we did some analysis to say, what can we do within the budget constraints that we have to really stabilize these providers. If you recall, last year, we really made an effort on the CLS, and we did some work there. So these are the two areas for this year's budget. On the inpatient side, we're looking at increasing the rate for the inpatient. That's probably going to be about a $2 million increase in this budget. And the other area is specialized residential. We've done quite a bit of work this year, working real close with our providers. I think we spoke about creating a standardized rate, which we've implemented, which also allows for some adjustment if they have specific needs within their homes. But through that work, we were able to not only standardize the rate, but increase the rate. And that's going to be almost an $8 million increase in our budget from this past year. And I can tell you right now, and if you talk to the providers, it's still not enough. I'll just let you know that right now. But it's what we can do with the uncertainties that we still have in the revenue and some of the things that Ken mentioned. So we're really committed to that. We'll touch on it probably when we see the numbers, but I'll just make the point here as well. We're also looking at 2025. So we're looking at this as a rate increase that we can adjust for 2025 and is sustainable into 2026. So what we've built into the budget, we're doing an analysis right now to see if we can adjust that for 2025, since we do have an anticipated or projected lapse. And to all of our goal, let's stabilize our network by adjusting those rates. So those are probably the two biggest things that are changing and are reflected in the budget. So I'm going to pause there because I said a lot. Any questions on that area? Okay. Couple other things then as we move along on the general fund, no real change there. We've been budgeting about 7.4 million. That continues. That's within that 5-year reallocation plan. So no change there. On the substance use and prevention, there too, it's all based on the block grant allocations. I think Leslie may even be speaking to some of those today. So we have not a big change in the SUD. And if you had a chance to look at the SUD budget year over year, it's pretty flat, but it's all based on the program allocations that we have and the expenses associated with that. The only thing that we're anticipating within this narrative here is if we can continue to grow the DCO providers in the substance use area, and we're looking at potentially one additional is our consideration. Okay, if you move to the next page, as far as the county match, it's about $3.7 million each year. No change there. We've built that into the budget and carried that over into 27 and 28 as well. PA2, $3.6 million, pretty much flat, so we've carried that forward. No real change there. Under the general assumptions, just speaking about payroll for a moment, we work closely with the county to look at our manning table, to look at the positions, so there's no change. We're at 362 positions. It's been pretty stable for the last several years, and going into this budget, we're still at the 362. And working with the county, the assumption that was put in for increases was 2%. So this reflects a 2% increase for those county positions. In addition to that, whenever we budget, even though we consistently have vacancies, the budget does reflect having every one of those positions filled. So as you know, many times we'll have a favorable variance just because unfortunately we do have vacancies, but we do budget for the full complement of resources that we believe we need. And then if we didn't target a specific increase, such as the specialized residential or in the payroll, we did apply an overall 3% inflation increase to other expenses to account for that. And that would be also going into 26 and 20, or 27 and 28, a 3% overall. And those are the biggest things to highlight in the expense area. Any questions? Okay.
I'm going to cover the other significant budget assumptions and kind of tie it in with a future page. You'll notice in the actual, I'm going to say the income statement format, you'll see that the revenue remains static in fiscal 27 and 28. We blanket increased expenses in those columns. The reason being that I probably wouldn't even presented 27 and 28 unless it was something that the county required as part of their format. But As we all know, fiscal 27 is a question mark for a lot of reasons, right? So I just wanted to throw that out there. It was it's noted in the files here, but we didn't spend a ton of time working on that, which I don't think would be a good use of time considering what we have. Obviously, this time next year, we probably have a lot of work to do for different things. So it's as far as I know, not a legal requirement to approve 2 years out, and that's why we have that presented that way. So I'm going to go to the next page. It's our what I call our funding source bucket report. I think it's on page 12 of the packet, if I'm not mistaken. If you add up the two boxes, the first two boxes, kind of how we always look at these funding sources, we settle Medicaid and Healthy Michigan together. So adding those together, you'll see that we have a $13.6 million deficit going into 26, right? As Tony mentioned, our goal is to, we have revenue in 25. We want to support our providers, inpatient, residential, the things Tony mentioned. So pushing those dollars back. To do that, we have to, prove that that's a sustainable thing. It's a reasonable expense and something that we're doing to help our network. So when we look at that, and if you tie that into the bottom of the page, we do anticipate taking dollars out of our ISF in fiscal 26. That's somewhat of an unusual change for us as an organization, right? We've spent a lot of years putting dollars into the ISF. As I stated, supporting our providers and our network, our teams is important, and that's why we have it, is for times like this when rates decrease, our risk profiles change. So we anticipate taking some dollars out of that fund. As a reminder, we anticipate ending fiscal 25 with $58.8 million in the ISF. That amount, as we know, continues to be in question with the state. We've going back to, I think, fiscal 22, and the actuary analysis that we feel is appropriate and how we funded that ISF. So I'm going to stop there because I feel like maybe that's the biggest item in the budget this year. So I'm happy to take questions or comments about what we have going on there.
Anybody? If not, I've got one. So if things go south when it comes to the ISF and it's calculated their way and not our way, where would we be in terms of funding in the ISF? Do you have an estimate?
So if we decrease the ISF to what their interpretation is, right, I think we would be at roughly $21 million would be our ISF. So if we take 13.6 out, we've got 7.4 left. As a reminder as well, we have another vehicle called Medicaid Savings as part of our contract. That's fully funded at, we've got $22 million in fiscal 24. That is not in dispute. Those are dollars that we could use similarly. We would probably take the dollars out of the ISF as it is a dispute item and keep the savings. That was part of this, the strategy here, but that's where we would be. So, and not to mention our local fund balance and some of the other things that we've built up over the years. So.
Thank you, Ken.
Yeah.
Selena.
Okay, so we're looking at possibly giving some raises, but you're also talking about possibly a deficit. Are these raises going to affect us going into 2026? Are we going to be able to sustain them? Because what we're kind of playing around with is what we've been kind of talking about for the past year, that right now we look really good, but if the ISF gets taken back, if the budget goes down, this starting to sound like the storm that is about to hit us. Am I understanding that correctly?
I think so.
Oh.
Yeah,
That's just scary.
and I don't mean to make it sound doom and gloom, right?
Doom and gloom, but I think this is a conversation we've been having for over a year on why we have legal counsel, why we go into closed sessions, why we've been having these really kind of tough conversations to prepare that if the department decides to go, this is it, live with it, or leave it. We're gonna have to live with it and then try to shift. But I'm concerned that we're giving raises away with an imaginary number in a year from now that I just don't, I was on the other your inpatient rates with no notice, and the hospitals had to live with it. But guess what happened to our people? They were the last to be admitted to the inpatient units because you slashed us $100 a day. And we were one of the lowest payers at that time. So I don't want to get into that situation, that our people are suffering because we made a decision that affects them, because I'm gonna tell you what, at the end of the day, the hospitals need to pay their bills too. Because if changes come about, their emergency departments are 62% of their financial losses. And it's gonna get worse.
And I think we've recognized that, and, you know, I recognize it's also later in the year. We've been trying to sort out our numbers with the CCBHC and some other things that have played in, but trying to push those dollars back into 25. And we've heard from including our hospital providers into 26, that we need more. So that $2 million, I think, represents a $75 a day increase. So we've built this acknowledging that we've got dollars in 25. We've, you know, heard our providers, and we want to continue that into 26. And if that means taking it out of the ISF, that's where we're at.
Thanks, Selena. Donna?
I think right in the beginning, you said we didn't get the provider rates yet. Did you say that?
We didn't get our rates from the state.
Okay.
We have draft information that is pretty detailed, and we submit responses, but I don't know that the dial's going to move on that. So I
Yeah,
think we're looking
that
at-
was what my question
Yeah.
was. Do you know, like, there's no clue, like, when we're going to get our provider rates? You don't know?
I don't know.
I mean, isn't that like a big piece of this?
Yep, and this happens to us every year. I think there was one year where we were in October and got draft rates, so we were kind of just rolling forward what we have. We've generally seen increases, so it's, you know, coming back with budget amendments and things isn't necessary. With more revenue, our expenses haven't been overspent. But yeah, we're flying with what we have.
So is this based on the current rates, or?
This is based on the draft rates that shows a decrease to funding.
A decrease.
I expect us to continue to have a decrease. I think that we made a valid argument about lessening that decrease, but I don't know that the state's going to accept that.
Is that what the draft indicated, was a decrease? Okay. So is usually the draft, I guess then my follow-up is, does the draft usually indicate what the final rates will be?
It's usually pretty close.
Okay. Thank you.
Thanks, Donna. Any other questions before they continue? Because you still have more to cover.
I got more.
Thought so. Go ahead.
I'll keep rolling then with this page. If you look at the CCBHC boxes there, the intent here is we will not have the 3 new CCBHCs. They're not budgeted as part of this. They're going to be direct pay. So we've taken the revenue out. We've also taken the expense out. But our CCBHC, we expect to operate that. If you add those 2 boxes together, the surplus deficit there, it's about 1.1 million. So projecting that our CCBHC will operate at a loss. Now, there's a couple caveats here. As Tony mentioned, we have kind of fully loaded our salaries and fringe expense, right? So we've budgeted vacancies at the top of the range and included some, so that anything that hits those internal lines that you'll see in the future pages is roughly 90% CCBHC. We didn't adjust days for that. In theory, if you have more individuals working and providing service, you would have more PPS 1 days. So that's kind of a caveat related to that. However, when you subtract 3 of our biggest DCOs are the new CCBHCs. Well, at least 2 of them are quite large. So those were lower cost services that were factored in as part of our PPS 1 rate for years. Now pulling that out, our PPS 1 rate is kind of locked in now because we were in what they call cohort 1, which was the original. So we've kind of lost some funding that is related to that too as well. So we're not generating PPS 1 days for that. I don't know that the state, It's been a while, but I think we talked to them about that fact and revising our report, but I don't know that that's going to get a lot of traction either. So I would say those factors here were, as it ties into that, and then a reminder, we've, over the years, I think, ran a surplus in CCBHC of roughly $30 million in the aggregate. So we have some bank there as well to keep this program going and hopefully break even. The program's kind of designed that way, where you do your cost reports and it'll trend out over time and you're closer to break even. So questions on CCBHC?
Doesn't look like it. Keep going.
All right. Next page, we can talk about CCBHC non-Medicaid. This is related to our CCBHC. We continue to see an uptick in folks without insurance. As a reminder, we're required to serve them, doing everything we can to get them on Medicaid if they're eligible, bill first and third parties, all the things that we need to do. But we do expect an increase in that expense. So I didn't put anything in here for the GF specific allocation. It's I think the last number we have is from fiscal 24 is about $350,000. I expect that number to go down in 25. We don't have that number yet. It's negligible, really, I think at the end of the day, what it's going to be. So that's why it's zero there, in case anyone was wondering. But if we go down to the next box, our state general fund, a lot of the initiatives that we've had are working well with that. We're managing utilization as it pertains to GF. Again, making sure people are applying for and getting on Medicaid should they be eligible. So you can see there that we actually have expense lower than revenue, which was not the case when we exited the pandemic and shortly after. So a lot of kudos to the team on that. There's been a lot of work done to improve that situation. And then there at the end, you can see that's just the aggregate. We don't expect to put anything into our fund balance in fiscal 26 because of kind of the fallout of everything we've talked about so far. So, any questions on this page? All right. The next page, the next 3 pages, we have the back 2 pages are the mental health fund and the SUD fund broken out separately. Page 14 is just the aggregate of those two. So we're not going to go into detail on the fund breakouts unless there's specific questions from the board. We're happy to answer those. But we'll focus on page 14. I'm going to cover the revenue piece here. I think we've talked about everything in this box. We can see the decrease from projected 2025 to 26 is dramatic. My HealthLink is budgeted as 0. Just as the group knows, that program only was part of 2025, fiscal 25, so that's why that's budgeted at 0. And then again, a number of the other items are static or close to static. So, Tony, do you want to cover the expense?
Then on the expense side, I'm just going to point out a couple numbers that we talked about in the narrative, and then you can see what the impact is here on this page. So the first one is around general administrative. If you look at the June 2025 projected at 26.3 million, and then the budget at 31.6, the increase is largely in the salary line right below. And again, that is because in the actuals, we have a lot of vacancies. We're not paying those salaries, but we fully budgeted for those in 2026. That's why you'll see the increase from projected to budget. And that will be the same case under the internal services, where you see 10 million in salary, or just shy of 11 million projected, but we've budgeted 15, same thing. We have vacancies we're not paying for, but we're budgeting for them. The next number to highlight is the provider network services. You're going to notice that we're at about 253 million projected, about 253 budget. The main reason for that is what we talked about, is going backwards and funding in 2025 at the same rate levels that we're budgeting for 26. So that's the work we're doing now to push more dollars to stabilize our network. And that way, and as we do that, then we're not anticipating a year-to-year change, since 2025 is going to also then reflect those rate adjustments. And then the final number I was going to highlight is actually right above the provider network where it says other. There's 22.8 million projected, and it's going down to 15.2. That decrease is the adjustment in DCO, so expecting that we're going to reduce it by about $5 million of the DCO expense, and that's what is driving that decrease in that line item.
It may seem counterintuitive to have provider network expense, but when they're DCO, they're both, we're both financially and clinical responsible for them, and we cost them with the rest of our direct services. So that's why it's lumped in with that and the decrease there.
All right, any questions or any other numbers? Okay.
Not seeing anything. Go to the last page, or are you guys done?
We're done. The last 2 pages are the fund breakouts that I mentioned, but if there's not specific questions about those, I think the page we just covered is reflective of the major items.
Okay, well, I have a couple of things real quick.
Sure.
Since we have a few new board members, could you run them through what the budget process looks like on an annual basis?
Sure. So we bring it here, obviously, to program and budget, assuming that the group advances it to the board. We're required to have a approved budget before the start of the fiscal year. The Uniform Budgeting Act requires that. So we bring it this time of year. We spent a lot of work on this, and the team and Tony and team on gathering these details over the last few months to come up with these things. Should we be partway through 26 and there's significant change to this, then we would come back with an amendment, particularly on the expense side, or a large decrease to revenue, right? That would kind of those negative items, if you will. So Phil, I don't know if that answered. Okay.
Yeah, you're good. Because then when it's done with us, it also goes to the Board of Commissioners too.
Oh.
And Tracy and the team will present, because it's also part of our budget. But the thing is the fiscal years are slightly off. Ours begins October 1st, the county's is a calendar year. So there's a little, and there's adjustments to be made for that as well at the county level and for us. So it's not just pass this and move on.
Yep. And to that point, we have had some meetings preliminarily with the county and their standard process about budgeting. And we've been very candid with Vicki when Tracy and I met with her and team, and we're going to be coming back with some different numbers for them. But as Phil mentioned, I think this is going in October, November timeframe, ideally to the BOC. So, I think we committed to the end of next week for those revised numbers. But we've covered the major assumptions with them, and
Just to add to, prior to coming to you, the SUD dollars have to go to our SUD oversight board, and it has already went through that process. Does that make sense? So you're the second step of the 3-step process.
the Oversight Policy Board does have a number of roles, but one of the very specific roles is approving the PA2 funding and how that's used. So that's key there.
And I just want to give a big shout out to our finance team and Tracy. And I mean, we're working on a lot of assumptions here. We're working on a lot of question marks. The provider rates, the county's audits. I mean, we don't necessarily have firm numbers from previous years that we're working off of. They're close. We have good ideas, but those numbers aren't final yet. And then you still have the state budget hanging out there. The big beautiful bill was just completed recently. So all of this, you talk about a perfect storm. I mean, we're sitting in it. So these numbers, we know will change. This is not a final budget by any means, but there's a lot happening and a lot of numbers being thrown all over the place. And I just want to thank all of you, because it is not an easy task, and I'm gonna have to sit through it in the county in a couple months. So I'm gonna call you guys for help, and assistance, and therapy. But I just want to thank
Not us.
thank
We're
the team. I just want to thank the team for all your hard work, because this is not easy. It's not easy any regular year, and it's especially not easy this year. So thank you.
We appreciate that.
Anybody else?
One quick question.
Julia, go ahead.
Can you explain the group home expense and why there's like a massive drop off? Am I missing something?
No, I don't think so. Part of that is we're we're looking at containing some of the group home expense is not the services in the homes. When we have that line, it's when we pay for anything out of room and board. So let's say we pay to have a floor replaced in a group home, we can't charge that to Medicaid. So some of those costs fall out here. Any excess lease costs we have would fall out to here because they're kind of room and board related. So we're expecting a decrease in those things as we try to move leases off. We're doing some work with as we increase the provider rates, and we have other programs where we pay for vacancies and things. So we're trying to limit that expense as it hits our GF versus Medicaid. So that's the reason for the
And can I
decrease
add?
there. Great question.
If it's helpful, just to give you numbers, I think a couple years ago, we were leasing about 120 homes. We're going to be down to about 40 this year. That's our goal. 'Cause remember, we don't want to be in the leasing business, but ultimately, that's why that line, because the goal is where we don't have that line item, or it's very unusual to have that particular line item.
Thanks, Julia. Any other comments or questions? Okay,
Thanks.
thank you both. We have a motion and support to move this to full board. All in favor, say aye. Aye. All opposed? Motion passes. Next is item D, request to approve 25-26 PIHP contract. I'll take a motion to send that to full board. Motion from Lori, support from Julia. Tracy?
As you can see, it says pending legal review. We just received it Monday. I don't remember it was this week. Anyway, so obviously legal, Drew needs some time to look at it. Also, to be fair, we all need time to look at it. We gave you some quick bullet points, but I'm going to give you a little bit more information, just with the disclaimer that at full board, we hope to have even a better review. What has been reported to be edited and more specific is the CCBHC language was removed due to the transition of fee to service, right? So as Ken was just highlighting. The CCBH payment language was removed for obvious reasons. CCBH quality bonus language was removed, and it removed and replaced a certain section with outlines recovery and monthly reporting for provider overpayments with OIG audit findings. Other things is another OIG monthly change of a requirement. It's to align with a specific code of federal regulations that has changed. It did remove the recovery incentive pilot language because the program will no longer be funded through the PIHPs. So that program will still exist, it just won't be coming through that avenue. And if you have any questions, Helen would do a much better job of explaining the details related to it. And then it also resolved language. I'm gonna use what they said it said, with my obvious, I disagree with what it's saying. Resolve language discrepancies between one-on-one transition and ISF sections, so the PHPs must return any remaining funds to the state upon contract expiration. So we will do a further analysis of that and probably give you a little bit more detail about what that says. But obviously, that's going to be one of the items that we can ask questions, but in our current state of being, there's not really any negotiation. So that is the very high level. We'll try to give you a little bit more at the full board, but I welcome any overall questions, knowing that I've had like a day along with other things to look at the, 142-page document.
I think it's 148. Don't sell yourself short.
Yeah.
Any comments or questions? Okay, and in the meantime, as you're reading through it, like the rest of us throughout the next 2 weeks, please feel free to shoot questions to Drew and Tracy, and we'll get them answered for you. And with that, we have a motion and support to move it to full board. All in favor, say aye. 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 All opposed? Motion passes. Next is item E, request to approve fiscal year 26 MDHHS grants. Take a motion to move that to full board. Motion from Megan, support from Donna. Leslie, go ahead.
Appreciate it. Hello. So we are requesting to approve again the fiscal year 26 grants, same grants as we've been awarded over the past few years. We're grateful in the uncertain times that we are able to be looking to approve these again for another fiscal year. So the grants typically are the 988 Suicide and Crisis Lifeline. You all have the kind of Cliff Notes version of what they cover and what they're for. We want to continue that cooperative agreement to be anti-suicide in our county and promote mental health treatment for individuals in crisis, and continue the availability of the 988 using the staff and the vibrant system that grant funds and pays for, to allow us to continue hopefully supporting the community in crisis via the 988. And can I just add a side note? The number of individuals in our community who still don't know about 988, including professionals, individuals in law enforcement, first responders, it is forever amazing. But luckily, we are in a position now where we're able to not only fund the staff to run the 988 line, we're meeting the metrics very well, but we're also in a position where we're able to use some of the other grant funds, which I'll get to in a moment, to promote the 988 line and give more information around it. And September is Suicide Prevention Month, so we're very, very passionate about promoting that line and supporting our community in crisis. Then we have the drop-in centers, which is Liberties, and that is the drop-in center is not the same thing as Clubhouse, but it is a safe space for individuals with serious mental illness or substance abuse disorders or co-occurring disorders to essentially drop in, hang out with other individuals in a structured and safe program that provides them opportunities to do mindfulness, yoga. They have a computer station that we were able to purchase items for using the grant funds to help individuals build resumes, apply for jobs. We're also able with that grant fund to pay for a hygiene support program where they have a professional stylist come on site 1 to 2 times a month and offers free haircuts to the members to help them, maintain grooming and stay clean and fresh for their activities or for jobs or potential employment. And that is that they have to sign up. So it's not just kind of a walk-in. They have to sign up, but they post those sign-up sheets. And then it also helps pay for additional activities for them to do together as a group. So they go to the zoo, they go to different community events, just to build that network and that sense of community with other people who are struggling with serious mental illness and substance use disorders. It's a great center. They recently moved. They're now a little bit more centrally located on Gratiot. The facility is great. If you haven't had the chance to drop by, please don't hesitate to reach out and we can get Nancy to host us. It's always a wonderful experience there. And then we have the Infant and Early Childhood Mental Health Consultation and Child Care Grant. It's a long one, right? But I try to spell it out because all these acronyms that we live with, right? It's a fun time. But so that is a grant that provides support for the child caring centers in Macomb County. And we have an infant mental health endorsed clinician and supervisor that provide that consultation, provide trainings to the staff to help support infants and young children and their mothers and caregivers and fathers, of course, in giving those children what they need and getting that early intervention so that they can hopefully be more successful as they grow and develop into older children and eventually adults. So they work through the school district and the MISD, and they also work with different child caring centers in Macomb County that are part of the MISD and those early periodic screening and diagnostic treatment services. And the grant funds the staff for that, as well as the some of the programming that they offer to the child caring centers and the schools. And then the Integrated Healthcare Grant, which offers grant funds to promote initiatives and activities related to whole health and wellness and integrated care. Many of you have attended our now 3rd annual Integrated Health and Wellness Fair that we co-host with the MISD, where we are able to use those grant funds to promote that health and wellness and offer education around mental health, physical health. We have booklets of information that we hand out with some other bags and swag, things that are functional for individuals in our community, both who are receiving services and who aren't, to just get more information out about not only our services, but health and wellness, right? And taking care of the whole person, being mindful of the mind-body connection and how we can support individuals in our community with that. As well as branded and promotional materials, we've been fortunate enough to use some of those grant funds to support our Veteran Navigator, in addition to the Veteran Navigator grant, but also our Housing and Resource Assistant, Connie Lasher. We've been able to use some of those funds where we because we don't want to underspend too much, right? Because then they take some of the funds away. So we were able to purchase some tents for individuals without housing with that grant fund for Connie Lasher to hand out for individuals who are really in need of some form of shelter while she was working with them to get them housed, employed, and all of those things. So those are just some examples of what that funds, as well as our integrated care liaison, who is on site at My Care as well as Judson, and facilitates that integrated care and connecting people from physical health to mental health, and mental health to physical health, as well as dental care. OBRA is the pre-admission screening annual resident reviews for individuals with developmental disabilities or mental illness who are in need of nursing facility placement. So that grant covers the staff, the psychiatrist, the nurse, all of that's needed to do those assessments to determine the appropriateness of that nursing facility level of care for individuals that would be receiving our services, IDD and SMI population, to make sure that in the nursing facility, they're getting those mental health services or developmental disability services that they also need in conjunction with that nursing facility care. Technology grant funds some technology supports to, again, promote mental wellness, mental health, and to help us get better data so that we can do data and outcome-driven, so that we can promote the data-driven and outcome-driven initiatives that we're working on so that we're not just guessing and assuming, right? So we want to have data to support what we're doing and why we're doing it. And so we do that with the Symmetry software that's paid for by the technology grant, which is formerly known as AFIA, as well as the KPI and the HIDIS measures. We use the grant funds to support some of that. We also use it for the psych surveys for dialectical behavior treatment. There are groups that are ran for individuals with borderline personality disorder as well as other disorders where DBT is the most evidence-based and effective treatment for them. And the psych surveys are funded for that, and that is just a supplement to the work that they do in that DBT group. We also use it to fund the talk and text reminders for appointments to help improve and decrease no-shows and improve engagement, as well as the Willits Tech software, the PUPS check-in, which is getting overwhelmingly great reviews from the providers who are utilizing it. And we get alerts when somebody answers a certain question a certain way, and then the provider is immediately following up with those individuals to support them, get them in, get them what they need to hopefully reduce the need for higher levels of care, such as inpatient care. And so that's all paid for with our technology, as well as the MyStrength app that we've been using in Macomb County for many years and are able to offer for free because of this grant and the money that we are able to use to fund that. And that's available to anybody in Macomb County, whether they work, receive services, live, or otherwise in Macomb County. And it's just a nice mental wellness app that people can use for stress relief, mindfulness, relaxation, and different techniques and tips for anxiety and things of that nature. And then we have our Veteran Navigator, which it funds mostly the Veteran Navigator position, but that also supports the certified peer specialist that works with our Veteran Navigator to support vets and their families in Macomb County and get them connected to resources and supports, housing, treatment, whatever it is they may need. And the wonderful thing about the Veteran Navigator program and the grant that covers this is that it's not only available to individuals who are honorably discharged, it is available to their family and anybody, whether they were dishonorably discharged, medically discharged, which isn't the case with some other veteran programs. So the Veteran Navigator program is really valuable to some of our vets who maybe were not honorably discharged, but still need that help and that support. And so the total amount for the FY26 grants, and I broke out OBRA because OBRA is a large amount, right? Because we're funding a lot of staff with that. But so the total for the grants, not including OBRA, is the $843,396 that is funded by MDHHS. And then we do report quarterly on all of the objectives that we have set forth with the work plans for these grants that the state has authorized us to do. And then with OBRA, we're in the $2,697,549. So it adds a substantial chunk of money to the total of the grants that we're looking at. Does anybody have any questions about any of those grants, what they fund, how we report, or any of that?
Leslie, thank you for the great presentation and breakdown. I have one question. If nobody else has a question, the dollar amounts,
Yes.
are those solid regardless of what goes on with the budgets, state, federal, whatever? Those are solid dollars that we are receiving?
As we are being told, yes, they are solid dollars this is what we've been receiving, and they have told us that they will be renewing these grants for fiscal year 26, 27, as Ken and Tony said, is a question mark, but they did confirm that these amounts would stay.
Great.
Yeah.
Thank you.
Yeah.
With
Okay.
the disclaimer that technically they can withdraw them after the fact. Just
Yeah.
as they have done.
Strike that disclaimer from the record.
They're set unless they withdraw them. Yes, thank you, Tracy. I probably should have added that caveat, right? Footnote.
All right, thank you. Seeing no other speakers, we have a motion in support. All in favor, say aye. Aye. All opposed? Motion passes.
Thank you.
Thank you, Leslie. Next, we'll move on to item F, request to approve a budget of $10,120 for MCCMH to pursue CCBHC and CQA. Any other letters you want to add, Timma? Accreditation. I'll take a motion to move this to full board. Motion from Sharita, support from Lori. Timma, go ahead before I can't talk anymore.
Good evening, everyone. As most of you may already be aware, maybe Jackie, since you're new, currently MCCMH is pursuing MCQA. MCQA stands for National Committee of Quality Assurance. So we are currently pursuing this accreditation for our managed behavioral health organizations. But now with all the changes that are going on, we thought it wise to proactively include CCBHC into this accreditation process. So by including CCBHC into this process, it's going to actually allow us to provide better quality of care for our members. It's going to open up additional funding opportunities because we are going to be NCQA accredited. It's going to also better position us and also make us stand out from other CCBHCs that are competing with us if there are any opportunities for contracting. And above all, it's going to also demonstrate our accountability and our determination to provide better quality of care for our members served and also for the community at large.
Thank you, Timma. Any comments or questions for Timma? Okay, seeing none. I think it's money well spent. All in favor, say aye. Aye. All opposed? Motion passes. Thank you, Timma.
Thanks.
All right, next one, item 6, receive and file, no items there. Item 7, resolutions, no resolutions. And we'll move on to item 8A with CEO update from Tracy.
I will be short. Some high-level updates. There, as previously shared, there is a current lawsuit with 3 local CMHs and 3 PHPs with MDHHS. There is a hearing scheduled for September 16th for them. If we find out that hearing is available to the public, it's a court hearing and available via Zoom. We will be sharing that information for parties who might be interested in watching it. There is an open letter in front of you. The open letter, if you'll notice, does have the support of the ARC of Michigan, NAMI of Michigan, and several other individuals and organizations. I mentioned those two because, as you know, when this PHP procurement originally started, those were organizations that were supportive of the procurement. They have now changed their stance. Once you read the letter, you'll see that they're opposing the procurement of the PHP. So I would encourage you to read the letter. I would also encourage you to note the signature that appears in the mix of those of Mr. Nick Shimatero, and he actually was directly involved in helping write the letter and giving feedback. So of course, make sure to thank and congratulate him on a job well done, as he has spent a large number of time doing that and several other things. In addition to that, if you haven't already seen it, we will be sharing it, just so you have additional insight of what is occurring in our community and at the state level. There was a committee oversight meeting that was held yesterday it's been recorded and you can watch it with MDHHS, and they asked some really good questions. There's several times where they talk about the PHP procurement, so it's a good opportunity for you to kind of get different perspectives and questions that are being asked. We'll pester you on this, you've heard this, but Walk a Mile is next. It's the 17th. I think That's, what is that, Thursday, anybody? When? Yes.
Week from today.
Wednesday, yes. In Lansing, if you're able to go, we would of course encourage you to go. It's a great opportunity. We have a decent amount of individuals who will be attending. There are still a few number of spots on the bus, as in Crossroads is going, so if you want to go with that, but you can also go on your own, and we're also, when individuals who don't want to go on the bus, a couple of people are kind of collectively going together to go up there, so that's also an option for you to pursue. If you want a t-shirt, there is some left. So if you, we need to know your size sooner than later before they fill up, and they can set those aside. And then another update on the PHP procurement. If you notice these days, that's a lot of our time and energy, unfortunately. But we and many organizations submitted hundreds of questions regarding the PHP, as that would be part of a normal RFP process. And the questions have been delayed, or the answers, I'm sorry, have been extended. So the most recent extension, there should be answers posted this Friday. But they have extended twice already. And to be fair, it's a very complex issue. So one of the main things is we really need to see the answers to those questions, so we have a better understanding of how we can successfully move forward. And I'm happy to answer any questions or talk about any other areas if there's areas of concern, but that is my update.
Thanks, Tracy. Any questions, comments for Tracy? Okay. Move on to reminders. We have full board here Wednesday, September 24th at 6 o'clock. And I don't see any providers in the audience to comment, so we'll skip that one. Hearing of the public. Anybody from the public? Everybody in the audience already spoke. We will close the hearing of the public and take a motion to adjourn. Motion from Megan, support from Julia. All in favor? Aye. Opposed? We are adjourned.